Welcome back to the deep dive. Today, we are wading into, well, a really emotionally charged topic.
It's a huge one.
Yeah, the impact of stress on IVF success.
And it's the ultimate guilt trap, isn't it? For anyone going through IVF, the whole process is this high wire act of hope and fear.
Totally. And then after an unsuccessful cycle, the first question so many people ask themselves is, was I too stressed? Did I ruin this?
And that question gets so much louder because of that one piece of advice everyone seems to give.
Oh, I know what you're going to say. Just relax.
Just relax and you'll get pregnant. It's so damaging because it puts all the responsibility for this incredibly complex biological event right onto the patient's emotional state.
It implies it's an emotional failure, not a medical one.
Exactly. So our mission today is to, cut through that noise. We're going to look at the real biology and psychology of stress.
And hopefully free you from that awful burden of guilt. We're going to unpack the science, show you where stress does matter, and maybe more importantly, where it absolutely doesn't.
Yeah. And the key thing to know right from the start is this. Stress is not some simple on-off switch for implantation. It's a factor, for sure, but it's almost never the main reason for failure.
All right, so let's start by deconstructing what we even mean by stress in the IVF context. Because it's a lot more than just feeling nervous waiting for that beta HCG test.
It really is. I think the first myth we have to bust is that you can just get rid of stress.
Which is impossible.
Completely. IVF is inherently stressful, financially, emotionally, physically. The goal isn't zero stress. I mean, that's just not realistic. It's about getting to a manageable level where your body isn't in a constant state of crisis.
And when most of us think about stress, we're probably just thinking about the emotional part, right?
That's usually what comes to mind first. The fear of failure, the worry about money, the anxiety during that 2-week wait. And that's all perfectly normal. It's a human response.
But the body doesn't really separate that from physical reality, does it? We have to talk about physical and hormonal stress, too.
We do. Because when your body calculates its total stress load, it adds all three together. Physical stress is a huge piece of this.
Like what?
Like chronic lack of sleep, or irregular eating habits, skipping meals, even things like too much caffeine or nicotine. Those things put your body under real physical strain.
And that physical strain leads directly to hormonal stress.
That's the biological connection right there. When you have these sustained pressures, both physical and emotional, your body starts pumping out more cortisol, the main stress hormone, and adrenaline.
Okay.
But it also disrupts melatonin, which is so critical for our sleep cycle. So even if you're trying to be calm on the outside, your physical habits might be screaming to your body that it's under threat.
This is where the data should bring some serious relief, I think. Because the science has looked at this a lot, right? Measuring cortisol in people's blood, using depression questionnaires, all of it.
Oh, extensively. And the conclusion is, well, it's overwhelmingly reassuring on one very specific point. Most of the data does not find any clear evidence that immediate acute stress, the anxiety you feel driving to the clinic.
Or having a fight with your partner the night before.
Exactly. That kind of stress dramatically reduces the chance of implantation. The body is actually pretty resilient to those short-term spikes.
Okay, that is a huge point. So if that immediate nervousness isn't the magic off switch, what are the big influencers that the data points to again and again?
It always comes back to the biological foundation first. The factors that really dictate success have so much more weight than short-term anxiety.
You're talking about things like the patient's age.
Patient age, absolutely. The genetic quality of the embryo itself, the thickness and the structure of the endometrium, the uterine lining.
And the time.
And the precise clinical timing of progesterone, getting that window right.
So let me just simplify this.
Yeah.
If you have a high-quality, genetically normal embryo going into a perfectly receptive uterus at the exact right time, the odds are pretty good.
The odds are very good. And stress doesn't just come in and override all of those perfect biological conditions. If a cycle fails, it is far, far more likely to be a combination of those clinical factors, not the fact that you cried the day before the transfer. We have to let go of that blame.
Okay, so let's get into the mechanism then. Because if stress does have a negative effect, it's not that moment of panic. It's the long-term, chronic kind of disruption. What is actually happening in the body when cortisol is high for months on end?
Right. This is the real deep dive. Cortisol is great for short-term survival. That's your fight or flight. But if you're, say, sleep-deprived for months, constantly worried about work, skipping meals, your cortisol is just always high.
And when it's chronically elevated like that.
It starts to shift the balance of your other essential hormones, and specifically, it impacts hormone sensitivity.
So not the amount of the hormone, but how the body is listening to it.
That's a great way to put it. Think about progesterone. We sometimes call it the hormone of peace. It's what gets the uterine lining ready and receptive for an embryo. Chronically high cortisol doesn't just, destroy progesterone, but it can change the way the cells in the endometrium read the progesterone signal.
Like a communication breakdown.
Exactly. It's like a faulty dimmer switch.
Yeah.
The power is still there, but the cells can't respond to the signal properly. The light is flickering.
That makes so much sense. And you mentioned sleep and melatonin earlier. Why is that sleep debt such a big deal in this whole chronic stress picture?
Because sleep is the body's non-negotiable reset button. Melatonin doesn't just make us drowsy. It plays this huge, overlooked role in signaling the rhythm of the ovaries and the receptivity of the uterus.
Wow.
So when you're running on, say, 4 hours of sleep a night for months, you're constantly spiking cortisol, and you're never letting those systems that support fertility get into a stable, receptive state.
So one bad night of sleep from nerves before the transfer. Manageable.
Manageable.
Huh.
But a long-term biological deficit where your body never stabilizes, that's what creates the negative environment. It affects everything from your immunity to the microcirculation, the blood flow to the uterus.
Acute stress is a blip. Chronic stress is a sustained attack.
You got it. That's the whole story.
Which brings us to what might be the most important part of this whole conversation. Letting go of that psychological burden, this false control trap.
It's so powerful. Because IVF success is never guaranteed, right? So you're desperate for some control, and you land on this belief, if I am perfectly calm, it will work.
And when it doesn't?
The logic flips instantly to, I was nervous, so it's my fault. You internalize it as a personal failure.
So we need a serious reality check here.
Yes. The reality is there is no level of perfectly zen that guarantees a pregnancy. IVF works because of biology, not belief. If being calm was the magic bullet, clinics would just hand out yoga mats instead of doing complex lab work.
That's a great point. So the real task isn't to be some stress-free robot. It's just to survive the journey with as little wear and tear as possible.
That's the functional goal. And that's why just relax is such toxic advice. It sets you up to blame yourself. It implies the outcome was in your emotional control, and it minimizes the enormous reality of embryogenetics and uterine biology.
So let's reframe that. Instead of self-blame, we need more empowering self-talk.
Yes, you have to adopt language that acknowledges the difficulty. Tell yourself, this is a really hard medical treatment, and it is completely normal to feel stressed.
Or, I did the best I could for my body under these circumstances.
Exactly. It shifts you from guilt to self-compassion. And a quick word for partners here, too. Their job is to be a rock, not another source of pressure. No minimizing feelings, and absolutely no, you're worrying too much, that's why it failed.
Okay, so let's move from the myths to the actionable steps. These aren't guarantees, but they are realistic ways to create a calmer internal environment and tackle that long-term chronic stress.
Right. And priority number 1 is stabilizing that whole hormonal system. And that starts with sleep.
Getting those 7 to 8 hours.
Aiming for it, yeah. But it's not just about being in bed. It's about having a pre-bed ritual. Screens off for 30, 60 minutes, quiet light, winding down. You're signaling to your body that it's safe to rest and repair.
Okay, if sleep is number 1, what's priority 2?
Stable nutrition. And I don't mean a new stressful diet. It's the opposite. It's about consistency. Just keeping your blood sugar steady.
Because big spikes and crashes are a form of stress on the body.
A huge one. When your blood sugar crashes, your body releases cortisol to compensate. It sees it as a mini emergency. So regular meals with protein, veggies, healthy fats. It's all about hormonal stability.
And what about the big 3? Caffeine, nicotine, alcohol. What's the realistic advice there?
For caffeine, moderation is usually fine. 1 or 2 cups a day, unless your doctor says otherwise. Nicotine, though, it's pretty detrimental. It measurably reduces blood flow to the endometrium.
So it directly harms the environment the embryo needs.
It does. And with alcohol, it's wise to reduce your intake. Yeah. Your liver has to process both alcohol and all those hormones you're taking. You want it to prioritize the hormones.
Makes sense. And lastly, for those moments of acute tension, what are some simple, accessible tools?
Simple is key. You don't need another thing on your to-do list. Slow, deep breathing, just aiming for 4 to 6 breaths a minute for 5 minutes, can interrupt the stress response almost immediately.
What about movement?
Short walks, gentle stretching. If your clinic clear you for it, that can be great for releasing physical tension. And of course, just talking it out, journaling or talking to a trusted friend is so much better than letting that anxiety build up inside.
So wrapping this all up, I think this deep dive has completely reframed the conversation. The biggest message is one of relief. Stress is normal, and you should never, ever blame your emotions for an unsuccessful cycle.
If implantation fails, the focus has to be on a constructive analysis, not self-blame. Look at the big medical factors first, the embryo quality, the endometrium, the progesterone timing.
And only after that, take an honest look at the long-term lifestyle things, like chronic sleep and nutrition.
Exactly, the things that affect your overall biological stability, not the panic you felt in the waiting room.
We really hope this helps you shift from guilt to resilience. The goal is to maximize your medical chances while minimizing the psychological damage of the journey.
It is absolutely not realistic to expect yourself to be calm through this. Your goal is to support your body, medically and psychologically, and to remember this one crucial thought. Your worth as a person is never, ever dependent on the outcome of a medical cycle.
A really powerful thought to end on. Thank you for joining us for this deep dive into stress and IVF. Before we sign off, we have to emphasize that this discussion has been purely educational. It does not constitute medical advice. You should always consult with your own healthcare providers about your specific treatment and health questions.
And for more information on the complete process of in vitro fertilization, you can find some great resources on the portal, ivfforme.com.
We'll catch you on the next deep dive.